All right, today we are diving into something that, let's be honest, a lot of people have dealt with, but maybe don't talk about much. The urinary tract infection, or UTI. We're going to break it all down. What it is, why it happens, and what you can actually do about it. So let's jump right in. You know the feeling, right? That awful burning sensation, that constant nagging urge that you have to go, like right now. But then when you try, it's painful, or maybe nothing even happens. Yeah, if any of that sounds familiar, you are definitely in the right place.
Okay, so first things first, let's make sure we're all on the same page. What exactly are we talking about when we say UTI?
Simply put, a UTI is an infection that can pop up anywhere in your urinary system. And that system includes your kidneys, your ureters, those are the tubes connecting the kidneys to the bladder itself, and the urethra. Basically, it's the whole plumbing system your body uses to handle urine, and a UTI is what happens when some unwelcomed bacteria decide to move in. I love this analogy. Think of your urinary tract as a one-way street, right? Everything's supposed to flow out. But a UTI happens when bacteria, usually from nearby areas, get into the urethra and start traveling upstream. They're literally going the wrong way on a one-way street, and that's what causes all the trouble.
Now, it's really important to know that not all UTIs are the same. We can basically split them into two main types. The most common one is a lower UTI. You've probably heard of it as a bladder infection or cystitis. When most people say, I have a UTI, this is what they're talking about. But, and this is a big but, if those bacteria keep traveling up and reach the kidneys, it becomes an upper UTI, and that is way more serious. We're talking about a kidney infection, which is something you need to get checked out immediately.
Okay, so this leads to the big question, right? The why me question. Why do some people get these all the time while others don't? Let's get into the causes and the things that might put you at a higher risk.
So, who's the main villain in this story? Well, it's bacteria. And there's one bacteria in particular that's responsible for the vast majority of cases. E. coli. Yep, you heard that right. It's the same bacteria that lives harmlessly in our gut. The problem is, because of simple anatomy, it can sometimes find its way into the urinary tract. And get this, it's the cause of about 80% of all UTIs. That's huge.
So, who's most at risk? Well, to be blunt, anatomy plays a massive role here. Women have a shorter urethra than men. It's just a fact. And that means bacteria have a much shorter journey to get to the bladder. That's the number one reason why UTIs are so much more common in women. But it's not the only thing. Other things like sexual activity, being pregnant, or even going through menopause can also increase your risk.
All right, let's say you're starting to suspect you might have one. How do you know for sure? Let's break down the classic symptoms and how a doctor actually figures this out.
For that common lower UTI, the bladder infection, the signs are pretty classic, right? You're running to the bathroom constantly. It feels super urgent, and it hurts when you go. But here's where you need to pay close attention. If you start feeling sick in other ways, like you get a fever, pain in your back or side, or you feel nauseous, those are major red flags. That could mean the infection is no longer just in your bladder. It might have moved to your kidneys. And that's your cue to see a doctor immediately.
And here's a really crucial point. Just because it hurts to pee doesn't automatically equal a UTI. If that's your only symptom, meaning you don't have that crazy urgency or frequency, it might actually be something else entirely. This is exactly why getting a proper diagnosis from a professional is so important.
So what's the diagnostic process look like? It's actually pretty straightforward. First, your doctor's going to talk to you, right? They'll ask about your symptoms. Then comes the simple urine test, a urinalysis, which can spot the telltale signs of infection. And if they need more info, they might do a urine culture. That's where they actually grow the bacteria from your sample in a lab to see exactly what they're dealing with and which antibiotic will work best against it.
Okay, diagnosis is in. Now for the most important part. How do we fix it? Let's talk treatment. So, doctors have two main buckets they put UTIs into: uncomplicated and complicated. An uncomplicated UTI is what we've mostly been talking about. It happens in someone who's generally healthy, and it's usually pretty easy to treat. A complicated UTI means there's something else going on. Maybe the person is pregnant, or they're male. Yep, a UTI in a man is automatically considered complicated, or they have some other health issue. These just require a bit more care and a different approach to treatment.
The good news is, for those straightforward, uncomplicated UTIs, treatment is usually very effective. There are a few standard first-line antibiotics that doctors turn to.
A short course of one of these is typically all it takes to wipe out the infection and get you feeling back to normal in no time. Listen, once you've had a UTI, the absolute last thing you want is another one. So let's talk about prevention. How can you stop this from happening again? And here's more good news. A lot of prevention comes down to some really simple habits. Seriously, this stuff can make a huge difference. Number 1, drink more water. It helps flush bacteria out before they can cause trouble. And this is a big one. Don't hold it in. Go when you have to go. It seems basic, but these practical steps are truly your best line of defense.
Okay, and we have to talk about one very important special case, pregnancy. This is a game changer. Doctors will actually screen pregnant women for bacteria in their urine, even if they have 0 symptoms. Why? Because an untreated UTI during pregnancy can cause really serious problems, not just for the mom, but for the baby. So this is one situation where they treat it proactively, no questions asked.
So at the end of the day, are UTIs just an annoying nuisance? Well, sometimes, yes. But as we've seen, they can also be a warning sign of something much more serious. The key takeaway here is to listen to your body. Know the signs, know when it's just a simple issue, and know when it's time to call the doctor. That's really the key. Thanks so much for tuning in.